Good morning, my name is Maria and I am your attending nurse here in the Casualty Ward.
Good morning, Maria.
How may I address you for the documentation purpose?
My name is John.
How are you feeling now?
I'm doing great, nurse.
That's great. Nothing to be alarmed about your situation and you are now stable. However, as you have lost a considerable amount of blood, to stabilize it, you require a blood transfusion.
Blood transfusion, nurse. I am quite upset about it.
Don't be upset. Blood transfusion is an uncomplicated process. If you have some other concerns, please let me know, so that I can help you with it.
Nurse, I have heard that blood transfusion has chances to make HIV infected and I am afraid about it.
All right. Thank you for sharing your concern, and your concern is quietly sensible. However, blood transfusions are usually very safe because donated blood is carefully tested, handled and stored. Hence, I can reassure you that the possibility of infection is very small and rare.
But nurse, still there is a chance of getting infected, right?
Your question is understandable. However, care is taken to screen donors and the donor is selected only if they are fit and safe. Again, the donated blood is tested for possible infections. The whole process of collection of blood to the storage and transfusion is done in a sterile condition, thus eliminating the possibility of infection.
Okay, I take your point, nurse. Could you please explain to me the procedure and the risks involved in blood transfusion?
Of course, with pleasure. Can explain it to you step by step.
Oh, that would be great.
Okay, the first step is that your blood will be tested before transfusion. It is to determine your blood group. All right. In step 2, an identification check will ensure you receive the correct blood. During the procedure, an intravenous or IV line with a needle is inserted into one of your blood vessels. The donated blood that's been stored in a plastic bag enters your bloodstream through the IV. You'll be seated or lying down for the procedure, which usually takes 1 to 4 hours. The needles and syringes used are new and sterile. During the procedure throughout, a nurse will monitor you and take measures of your blood pressure, temperature, and heart rate. You should tell the nurse immediately if you develop some side effects such as fever, shortness of breath, chills, unusual itching chest or back pain, a sense of uneasiness. Are you following me?
Sure, I will.
After the procedure, the needle and IV line will be removed. The whole process is done following the medical guidelines and under supervision, ensuring the safety of the patient, thus eliminating risks.
Oh, I see.
Blood transfusions are among the most common medical procedures across the globe. Scientific research and careful medical controls make the supply of donated blood very safe. Everything under sterile conditions, new syringes uses, and as I told you earlier, the nurses will watch closely for your safety. All right.
I got it.
A low red blood count can cause you to feel fatigued and weak. If you have a lower red blood count than is normal, your body has to work harder to get enough oxygen to the cells. A low red blood cell count can cause a variety of symptoms and health complications, hence it is recommended to do a blood transfusion.
Okay, nurse, I agree with you.
The important thing is that since you lost a considerable amount of blood, the iron content in the blood which produces red blood cells will be lost, hence making it difficult to reproduce. A sufficient amount of red blood cells required for a healthy body. In such a situation, blood transfusion is the best possible way. I reassure you that the blood transfusion is safe and you can trust the process. It is essential and will not cause infection as you think.
All right, nurse, I understand your words. Thank you for such a good briefing. I am ready to do the blood transfusion.
Do you have any other concerns apart from this?
No, nurse.
Okay, John, and I will make the necessary arrangements for your blood transfusion. Thank you.